If you've ever felt frustrated, embarrassed, or just plain disappointed because you finished sooner than you or your partner wanted, I need you to hear this loud and clear. You are not alone. Premature ejaculation, or PE, is actually the most common sexual issue men report. Some studies say up to 1 in 3 men experience it, while other reports suggest that number could be even higher. It's a condition that's surrounded by myths and silence, and that leads to a ton of unnecessary anxiety and shame. My name is Dr. William, and I'm a board-certified urologist. For years, I've sat with countless men and their partners to help them navigate this very personal issue. My goal with this video is to cut through the noise. We're going to have a calm, real conversation about what PE is, the biological and psychological reasons it actually happens, and most importantly, we'll walk through the effective, proven treatments that can help you get back in control, feel confident again, and make sex intimate and enjoyable. This is a medical condition, not a personal failing, and it is absolutely treatable. Section 1. What exactly is premature ejaculation? So, let's start with a clear definition, because premature can feel like a really subjective word. In my world of urology, we generally define premature ejaculation by 3 key things. First, ejaculation that almost always happens within about 1 to 3 minutes of starting intercourse. Second, you feel like you can't delay or control it. And third, and this is the most important part, the whole experience is causing you significant distress and frustration, maybe even to the point where you start avoiding intimacy altogether. Now, it's completely normal for this to happen once in a while. Things like stress, a bit too much alcohol, or even just a long gap since you last had sex can mess with your timing. We're talking about a consistent pattern that's making you unhappy. This isn't a race, and there's no magic number for what defines good sex. The diagnosis is all about your sense of control and your satisfaction, not about a stopwatch. We also break PE down into 2 main types, lifelong and acquired. Lifelong or primary PE means this has been your reality since your very first sexual experiences. Men with lifelong PE sometimes mention that it runs in their family, which suggests there could be a genetic link. Acquired or secondary PE is different. This is when you used to have normal control, but then something changed, and PE started happening later in life. This shift can often be tied to something new, maybe a medical issue like an inflamed prostate, prostatitis, or a thyroid problem, or it could be connected to psychological things, like a new source of stress or conflict in your relationship. Figuring out which type you might have is a really useful first step for your doctor, because it helps point us toward the right diagnosis and treatment. But if you take one thing away from this section, let it be this. PE is an incredibly common medical condition. It has 0 to do with manliness or virility. The stigma is far more damaging than the condition itself, because it stops men from getting the help that is out there and works. Section 2. The 2 sides of the coin. Biological and psychological causes. One of the biggest myths about PE is that it's all in your head. While your mind is definitely a huge part of the picture, PE is really a complex issue with both biological and psychological roots, and they're almost always tangled together. Let's start with the biology. Your brain and nervous system are running the show when it comes to ejaculation. A key chemical messenger, or neurotransmitter, in this process is serotonin. Think of serotonin as your body's natural brake pedal for ejaculation. When serotonin levels in your brain are high, it helps delay the signal to ejaculate, giving you more control. When serotonin is low, that brake is less effective and things happen faster. Many guys with lifelong PE seem to have naturally lower serotonin activity, which is why some of the best treatments work by boosting the amount of serotonin available in the brain. Other biological factors can pop up too. Hormonal imbalances like an overactive thyroid, hyperthyroidism, have been linked to acquired PE. Low testosterone can also play a role, sometimes because it's connected to erectile dysfunction or ED. And speaking of ED, its relationship with PE is tricky. It's often a chicken or the egg situation. Some men who are worried about keeping an erection might over time develop a habit of rushing to ejaculate, which can turn into acquired PE. On the other hand, The frustration from PE can cause so much anxiety that it leads to trouble getting an erection in the first place. It's critical to figure out what's going on and treat both if they're happening together. Finally, physical issues like an infection or inflammation of the prostate, prostatitis, or urethra can cause irritation and make the area extra sensitive, leading to PE. In some cases, it might just be genetics, making the nerves of the penis more sensitive from day one. Now let's talk about the psychological side because it is incredibly powerful. Performance anxiety is the most common culprit and it creates a vicious cycle. A guy has 1 or 2 times where he finishes too fast. Then he starts to worry it'll happen again. That anxiety floods his system with adrenaline, which is a go signal for ejaculation, making him finish fast again. This just reinforces the fear, and the cycle gets worse. Stress is another big one. Whether it's from work, money, or just life, high levels of chronic stress can do a number on your sexual function, including your control over ejaculation. Depression is also tightly linked with PE, and you can't ignore relationship problems. Unresolved conflicts, a lack of emotional closeness, or just bad communication can show up physically in the bedroom. The pressure to perform for a partner can be immense. Finally, our first sexual experiences can set a pattern. If those early encounters were rushed because you were afraid of being caught, your body can learn to ejaculate quickly. That conditioning can stick around for years, even when the situation has totally changed. It's rarely just one thing. It's usually a mix of these factors, all feeding into each other. That's why the best treatment plans tackle both the physical and the mental side of things. Section 3. Getting answers. How a urologist diagnoses. I get it. The thought of talking to a doctor about this can feel really intimidating. A lot of men worry they'll be judged or feel embarrassed. I want to walk you through what actually happens so you know what to expect. Seeing a doctor is the single best step you can take, and trust me, we are here to help, not to judge. The diagnosis for PE is almost entirely based on a conversation. Your urologist will sit down with you and ask about your medical and sexual history. This is the most important part of the visit. We'll ask things like, how long has this been an issue? Was it from your very first time, or did it start recently? Roughly how long does it take for you to ejaculate after penetration begins? We're not looking for a stopwatch time, just a general idea. Do you feel like you can delay it at all? How often does it happen? Is it every single time, or only in certain situations? How much is this bothering you? And if you have one, your partner? Do you ever have trouble getting or keeping an erection? We'll also ask about your overall health, any medications you're on, and your lifestyle, like your stress levels and alcohol use. This whole conversation just helps us understand the problem, figure out if it's lifelong or acquired, and identify what might be contributing to it. For most guys with lifelong PE, if the history is straightforward, we may not even need to do a physical exam. But for acquired PE, a focused physical exam is pretty common. We might check for things like a prostate infection or other physical issues. Lab tests aren't standard for PE. However, if your history or exam points to an underlying issue, like a thyroid problem or low testosterone, we might order some simple blood tests. This is more common with acquired PE, where we're looking for a new medical reason. The goal is simple: to understand your unique situation so we can build a treatment plan that's right for you. It's a team effort, and being open and honest is the key to getting a great outcome. Section 4. Taking Back Control, a comprehensive guide to treatments. Alright, now for the most important part, what can we do about it? The great news is there are a ton of effective strategies, and very often a combination approach works best. We'll go through them from foundational techniques to medical treatments. Number 1. Behavioral techniques, the foundation of control. These are exercises designed to help you get more in tune with your body and learn to recognize the sensations leading up to orgasm so you can delay it. They take patience and practice, and they work best with a partner who's on board. The two classic methods are the stop-start technique and the squeeze technique. For the stop-start method, you or your partner stimulate the penis until you feel you're getting close to that point of no return. Right at that moment, you stop all stimulation. Cold. You wait until the urge completely fades, then you start again. You repeat this cycle 3 or 4 times before you let yourself ejaculate on the final round. The squeeze technique is similar. Again, you stimulate to the point of near ejaculation, but instead of just stopping, you or your partner firmly squeeze the head of the penis, or right where the head meets the shaft, for about 20 to 30 seconds, until the urge to climax goes away. This pressure actually lessens the erection a bit and kills the urge. You wait 30 seconds, then start stimulation again. Just like stop-start, you repeat this a few times before finishing. The point of both of these is to build awareness. You learn to identify that point of no return and get the confidence that you can, in fact, hit the brakes. I also strongly recommend practicing these techniques on your own through masturbation. It's a low-pressure way to learn your body's responses. And let's not forget pelvic floor exercises, also known as Kegels. The same muscles you use to stop the flow of urine are involved in ejaculation. Strengthening them can give you more control. To find them, just try to stop your stream next time you're urinating. Those are them. Once you know the feeling, you can do them anytime. Just tense the muscles for 5 seconds, then relax for 5 seconds. Try to work up to 10 to 20 reps 3 times a day. Number 2. Topical treatments. Turning down the volume. If having an extra sensitive penis is a big part of the problem, topical anesthetics can work wonders. These are sprays, creams, or wipes that contain a mild numbing agent like lidocaine. You apply them to the head of the penis about 15 to 20 minutes before sex. They just reduce the sensation enough to help you last longer without ruining the pleasure. One crucial tip, you have to wash it off a few minutes before penetration or wear a condom. If you don't, you can transfer it to your partner and numb them too. You can also find condoms that are a bit thicker or have a small amount of a desensitizing agent inside. Number 3. Prescription medications, a urologist's toolkit. For a lot of men, especially those with lifelong PE, medication can be a game changer. It's important to know that as of right now, there are no drugs specifically FDA approved in the United States just for treating PE, though some are in the works. However, we use certain medications off-label because they've been proven to be extremely effective. The most common and effective medications are selective serotonin reuptake inhibitors, or SSRIs. Technically, they're antidepressants, but for PE, they work by boosting the levels of serotonin in the brain, that brake pedal we talked about. A daily low-dose SSRI like paroxetine, sertraline, or fluoxetine can significantly increase how long it takes to ejaculate. These usually take a few weeks to build up in your system and really start working. There's also an on-demand option. A short-acting SSRI called duloxetine is approved specifically for PE in many other countries and can be taken a few hours before sex. While it's not approved in the US, some doctors may use other SSRIs for on-demand use. The choice between daily or on-demand really depends on your lifestyle. Another option for some men is a drug called tramadol. It's a pain medication, but it has a known side effect of delaying ejaculation and can be an option if SSRIs don't work for you. Finally, if you have both PE and ED, your doctor will almost always treat the ED first with drugs like sildenafil, Viagra, or tadalafil, Cialis. Often, once you're confident in your ability to maintain an erection, the PE gets better on its own. Number 4, counseling and new technology, addressing the root and finding new paths. We can't overstate the value of therapy, especially when things like anxiety or relationship stress are a big factor. A sex therapist or counselor can give you tools to manage performance anxiety, communicate better with your partner, and work through any emotional issues that are contributing to the problem. This isn't a last resort, it's a powerful treatment that gets to the root of the issue. Also, a novel electronic patch has recently received FDA clearance. This device is placed on the perineum, the area between the scrotum and anus, and uses mild electrical stimulation to interfere with the nerve signals that cause ejaculation. It offers a new drug-free approach, but since it's very new, its availability may still be limited. The bottom line is, you have options. You don't have to just live with this. Section 5. The partner's role. a team approach. I want to take a moment and speak directly to the partners watching this. Your role in this is so important. Premature ejaculation isn't just one person's problem, it affects the couple. Open, honest, and kind communication is the number one factor in getting through this. Talk to each other about how this makes you both feel. Reassure your partner that you see this as a medical issue you can tackle together. When you're trying the behavioral techniques, do them as a team. That transforms it from a secret burden into a shared goal. Your patience, your understanding, and your active help can make all the difference by lowering anxiety and creating a safe space for intimacy to grow again. I really hope this conversation has been helpful and has given you a clear idea of what to do next. If you got something out of this video, please subscribe to the channel for more straightforward, evidence-based health info, and I'd love for you to leave a comment below. Sharing your story can help so many others realize they aren't the only ones going through this. But the most important thing you can do is this. If PE is causing you distress, please talk to a doctor or another healthcare professional. This is a conversation we have every single day. It's a sign of strength, not weakness, to ask for help. And we have real solutions that can bring back your confidence and happiness. So, to wrap this all up, let's hit the key points one last time. First, premature ejaculation is a very common and very treatable medical condition. It's not a reflection of who you are. Second, its causes are complex, mixing biology, like serotonin levels, with psychology, like anxiety. Third, there is a whole menu of effective treatments, from behavioral exercises and topical solutions to prescription medications and therapy. You do not have to figure this out alone. The frustration and anxiety you're feeling can be solved. By getting informed, talking openly with your partner, and working with a doctor, you can take back control and enjoy the healthy, satisfying sex life you deserve. Thanks for taking the time to learn with me today.